Okay, we're going to continue with our musculoskeletal system in relation to your geriatric 2. So first, we have your muscular that involves your muscles plus your skeleton, okay, your skeletal system. Now we're going to briefly discuss it. We have the skeleton. It involves your bones. We have now your axial portion, appendicular portion of your skeleton. When you say axial portion, that is your able to rotate. So we have your cranium, we have your vertebrae, and of course your ribs, diba? And number 2, we have appendicular portions. It involves your limbs, your shoulders, and your hips. So they show appendicular. And types of bones. We have now your long and your short bones together with your flat. Then, irregular bones. Pag long bones, we have your humerus, tibia, fibula, and your short bones, we have your patella, and we have your flat bones, your metacarpals and metatarsals, and irregular bones. You do have your phalanges, diba? It involves your phalanges. And we have also spongy bone. These are located in the ends of long bones and the centers of the flat and irregular bones. So, example of that, di ba yung chicken joy? Yung chicken joy mismo, yung hinahawakan. So, the one that you're holding, the edge of it, at the end of it, you're going to feel the sponge. Masarap yung kainin kasi, soft siya. Tapos, may juice pa siya, di ba? Juicy. And this spongy bone was able to makes the person to withstand forces applied in many directions. So again, when you're going to jump, then when you're going to land, you will be landing on the floor. So with the spongy bones, you cannot be injured, okay? Unless ma-out of balance yung ano mo, pagbagsak. We have dense or compact bones. This covers your spongy bones and cylinder around a central marrow cavity. So those are the dense and then or compact bones. It is also can withstand forces predominantly in one direction. Functions of bones, we have support and your protection. Another, provide attachment for muscles, tendons, and ligaments. And we have also contained tissues in the central cavities which aids in the formation of blood cells. So remember that your bone marrow is a place wherein the manufacturing of your blood was made, diba? Assist in regulating calcium and phosphate concentration. Those are some of the functions of bones. Then, di ba we have already, you have the human anatomy. You are going to discuss there more fully about the skeletal system. Now, under the musculoskeletal system, we have also the joints. The joints has divisions. You have your synarthrosis, we have diarthrosis, and the other one is amphiarthrosis. Okay. We have synarthrosis. These are fixed joints or immovable joints. Fixed or immovable joints. Examples of which are sutures of the skull. Kanang bitang murag tayo isa mong skull or divisions of your skull. Those are joints. The example here, in your frontal or particularly sa imong buna, that is your frontal bone. Your frontal bone is connected to your parietal bone by means of suture. And another thing, your parietal is connected to your temporal by means of suture. So those are joints. And so on and so forth. You're connected to your occipital by means of your suture joints. And next is we have manubrial sternal joints, diba? In your, diba, your sutures of the skull is the one that, the joints that was able to protect now your brain. While your manubrial sternal joints, where is it? In your ribs, diba? You know your ribs. At the middle of the ribs, you have your sternum, the one that you're going to apply force when you're going to give CPR. So, your manubrial sternal joint, it also protects the upper part is your manubrium, and then the lower part is your sternum. That it is the joint that protects your heart, diba? And of course, your lung. And we have also gymphosis, the pelvic joint. Okay. Number 2 is your amphiarthrosis, limited movement, slightly movable joints. And these are your cartilaginous joints. So we have here your examples. We have intervertebral joint, your pubic symphysis joints, distal tibiofibular joint. So, intervertebral joint, your intervertebral disc. Remember that intervertebral disc that makes you have a good posture if you're going to stand, and it makes you much taller if you're going to stand properly. That is because of your intervertebral disc, intervertebral joint, or let's say disc. Another, your pubic symphysis, there is a joint there wherein it connects your pelvis. It connects two of your pelvis, two parts of your pelvis, the left and right. And then we have also the distal tibiofibular joint. It connects your tibia and your fibula. Okay. And the amphiarthrosis, freely movable joints. So these are synovial joints that consist articulation with joint capsule, and of course it has synovial fluid that of course lubricate constantly your bones, okay, particularly your cartilage. So these are types of diarthrosis. We have 6. One is ball and socket joint, just like example, your acetabular joint, the joint in your hip. Kasi yung yung femur mo parang may ball, 'di ba? It's a meat, 'di ba? Nakita niyo yung meat, may circle siya na malaki na naka-attach sa bone. Tapos yan ay ilalagay natin yun sa acetabulum, particularly your hip joint. So that is the ball, and the socket is your hip or your acetabulum. And glenoid humeral joint, meaning it also connects now your humerus. Where's your humerus? To your shoulder. Here. Your glenoid humeral joint connects your humerus here in your arm to your shoulder. And then next you have gliding joint, formed when two flat surfaces of bones articulates. We have like intertarsals, intercarpals, and intervertebrals. Intertarsals, diba? The eyepiece, before you're going to have the interphalangeal, so that we have also your intertarsals. And intercarpals also in your arm or your hand. And intervertebral in your vertebrae. And next is your hinge joints. Just like open or close in one plane or direction. Just like the door hinge, diba? Hinge joint. So we have here your tibiofibular joint or the knee joint. And we have also humeral ulnar or radial joint in your elbow. Okay. So that is your the humerus is connected to your ulna via your humeral ulnar joint or your elbow. And your tibia is connected with your fibula or in fibula because of your knee joint. And next is your pivot joints, allows rotation around an axis. We have your atlantal axial joint, the C1 and the C2, which enable you to carry heavy objects. Your Atlas, the strongest man in the world. And radial joint allows supination and pronation. The joint in your radial or your radius allows your supination and pronation. Now, next is your condyloid joint, formed when an oval-shaped surface meets an ellipsoid bone. So these are your irregular connections between irregular bones, and and just like also your saddle joints, irregular bones ang nag-connect. Characteristics of joints: we have allows the movement between bones formed where two bones joins. And surfaces are covered with cartilage, enclosed in a capsule, yun may synovial fluid, and contain a cavity filled with synovial fluid. Ligaments holds the bones and joints in the correct position, and articulation, meaning rotation, in the meeting point of two or more joints. Synovial fluid is found in the joint capsule, formed by synovial membrane, which lines joint capsule and lubricates the cartilage. Plus, it cushions for shock. That is also the reason why if you're going to jump, because of the synovial fluid, you would feel no pain at all or less, di ba? But if you became an elderly because of the absence of synovial fluid, you will suffer from arthritis. Do you get me? Next is muscles. Characteristics are we have made up of bundles of muscle fibers and provide a force to move bones, yes, and assist in maintaining posture and assist with heat production, diba? Heat energy production. And your skeletal muscles are attached to two bones and cross at least one joint. The point of origin is the point of attachment of the bone most closest to the trunk. The point of insertion is the point of attachment on the bone farthest from the trunk. Point of origin is your point of attachment on the bone close to the trunk, while your point of insertion is the point of attachment of the bone farthest from the trunk. We have skeletal muscles act in groups. We have prime movers contract in to produce your movement. Nerves activates and controls your muscles. We have here fractures, a break in the continuity of the bones. Types, you have closed or simple. Skin over the fractured area is remain to be intact. That is your closed or simple. Wala kang makitang opening. Another, we have green stick. One side of the bone is broken and the other is bent. Most common seen in children. Okay, bali. And we have your transverse, as in pa-across talaga yung yung fracture, straight across. And your oblique, we have the break extends in the oblique direction. And we have your spiral, the break partially encircles the bone. Oh, from the word spiral, di ba? Ang comminuted naman, there will be crushed or splintered fracture with three or more fragments. And complete, we have the bone completely separate by a break into two parts. Kung incomplete naman, a partial break in the bone. Open or compound, we have the bone exposed to air. If it happens, there's automatic there will be inflammation because there is a break in the skin, and soft tissue injury and infection are also common. Impacted is a part of fractured bone is driven into another bone. Okay, ning lusot kanang ang isa ka bukog hing lusot sa isa ka bukog. While you're depressed, our bone fragments are driven inward o pailalom ang pagkabali sa bukog. And in compression, a fractured bone compressed by another bone. Okay. Compressed by another bone, meaning nalatugan sa isa ka bone. Pathological fractures are caused by weakening of the bone structures by pathological processes such as your neoplasia or osteomalacia. These are called spontaneous fracture. This is pathological, meaning these are fracture made because of a existing disease condition such as your cancer. Assessment of a fracture of an extremity. We have pain. What did you remember is pag masakit, there is fracture. So, especially if the person cannot tolerate the pain, it is now your fracture. Pain or tenderness over the involved area, loss of function, obvious deformity, crepitation, or the sound heard because of that fracture. And then we have ecchymosis, malagom, erythema, ma-inflame, edema, muhubag, and muscle spasm. Okay, madako ang muscles, ma-red kay siya, and then painful. Impaired sensation, if ever, kung na-part nga kanang abi ni mo wala na fracture pero na fracture the eye because you cannot feel it. So we have there your initial care of fracture. We have immobilize affected area. Remember, pag fracture, dapat immobilize. Diba? In our wound dressing, if it is a compound fracture exists, splint the extremity and cover the wound with a sterile dressing. Now, we were going to discuss rheumatoid arthritis. So, basic lang yung discussion natin dito ha. So, I'm going to give the definition and short of its description. So, rheumatoid arthritis meaning chronic systemic disease affecting any or all of the body system and is characterized by most prominently by recurrent inflammation involving the lining of the joints. Anyway, this is hereditary. Weakens and leads to dislocation of the joints and permanent deformity. The cause of that is your unknown. Pero as what I've said, sometimes it is hereditary. Risk factors includes exposure to infectious agents, fatigue, and emotional stress can exacerbate the condition. We have also assessment. The area is inflamed, of course, from the word rheumatoid. So, and there will be inflammation, tenderness, and stiffness of the joints. Moderate to severe pain and morning stiffness lasting longer than 30 minutes. Okay. So, sakit kayo mo last more than 30 minutes. And there is joint deformities, sponges or soft feeling in the joints. Muscle atrophy, mugamay ang imong mga muscles. Decreased range of motion. This is brought about by your pain. Low-grade temperature because it has inflammation. There will be fatigue and weakness, and for some, they suffer from anorexia, weight loss, and anemia. Paresthesia or poor sensation of pain. Management. In case na pain, administer medications as prescribed, usually ibuprofen. Administer with meals or snacks dapat ang medication because it is gastric irritant. Monitor for side effects of medication. Well, in case of physical mobility, you have provide range of motion exercises to maintain joint motion and muscle strengthening. Balance rest and activity. Splints during acute inflammation to prevent deformity. O, dapat pag rheumatoid arthritis, naka-splint po ang client. Apply heat or cold therapy as prescribed to joints. Apply paraffin baths because it is soothing and massage as prescribed. Encourage consistency with exercise program. Dapat mag-lose weight pag may rheumatoid ha. Just like your osteoporosis, dapat mag-lose weight. Exercise only to the point of pain. Pag walang pain, yung isang kabila, i-limit yung exercise. Actually, pag mag-exercise ka, just kung ano yung ma-tolerate ng client, yun lang po. Instruct the client to stop exercise if pain increases, avoid weight-bearing or inflamed joints, and assess the need of assistive devices such as higher-level toilet seats, chairs, and obtaining assistance when possible. Body image disturbance because of the inflammation of your joints, rheumatoid arthritis, with the atrophy of your muscles. Encourage the client to verbalize feelings. Dapat so that the client could express her needs and her wants and then her perception about that disease. Assist the client with self-care activities and grooming. Provide patience and understanding and be aware that the client may be manipulative and demanding for some times because kasalanan, it is not only not only seen among your rheumatoid but almost all patients. The next is your osteoporosis. We have already have this. You have known osteoporosis, right? An age-related metabolic disease. There were bone demineralization, mawala yung mga minerals, sumabreak na yung bones, resulting in the loss of bone mass, leading to fragile porous and subsequent fractures. Occurs most commonly in the wrist, hip, vertebral column. Okay. Wrist, hip, and your vertebral column. So you have to take note of that, especially if you're handling an elderly. And can occur postmenopausal or as a result of metabolic disorder or calcium deficiency. Assessment. Back pain after lifting, bending, or stooping. Yes. Diba? Basta may back pain is associated, but not all with your osteoporosis. Back pain that increase with palpation, yes. Pag hinawakan mo, mas lalong masakit. Pelvic or hip pain, especially with weight-bearing joints, diba? Diyan, we have also manang loss of weight, yung dapat ang management, ani. And we have problems with balance, yes. Decline in height from vertebral compression. Kasi, di ba, pag mag-osteoporosis ka, you will become shorter kasi makompress na yung mga intervertebral disc. And kyphosis of the dorsal spine. So, mabako po ng individual with osteoporosis. And constipation, abdominal distension, and respiratory impairment as a result of movement restriction and spinal deformity. Kasi pag malikot yung matanda, may malaki yung chances na magka-fracture siya. Kaya i-limit mo yung movement. So, kaya walang movement, so highly constipated siya. At dahil sa walang movement, so there will be abdominal distension and somehow you will have your respiratory impairment. Madali lang siyang ubuhin, di ba? Management, because walang movement. Provide a safe and hazard-free environment and use side rails to prevent falls. Move the client gently when turning and repositioning. Remember, ang bones niya ay easily brittle. Encourage ambulation. Yes, dapat with assistance. Assist with ambulation if the client is unsteady. Instruct in the use of assistive devices such as cane and walker. Provide range of motion exercises. Instruct in the use of good body mechanics and encourage the use of firm mattresses for sleeping, and provide a diet high in protein, calcium, vitamin C, and D, plus your iron. And encourage adequate fluid intake. Instruct the client to avoid alcohol and coffee because it could lead to more brittleness of the bones. Administer calcium and vitamin supplement as prescribed. Bakit may as prescribed? Actually, pag may na tayo, pag matanda na po tayo, wala na pong kakayahan yung natin, yung system natin na mag-produce o mag-manufacture ng blood or so definitely kung wala na siyang kakayahan or limited na yung kakayahan, saan papunta si calcium? Aalis po si calcium from your bone marrow, papunta po siya sa kidney at magiging stone siya or papunta siya sa circulation niyo po at of course, it will attract the microorganism. So, it will become somehow a blockage to your circulatory system or your blood vessel. So, pag naging blockage siya, so the flow of blood now will become slow, leading to what we call heart attack. So, dapat limit lang po yung si calcium. As much as possible, do not give calcium, especially kung elderly na. You can have a calcium when you were still young as a foundation of your bones, but after that, no. Just ensure comfort and safety, that's all. Then, next is your osteoarthritis. This is degenerative joint disease. Degenerative meaning magkagrabe siya. And it affects elderlies. Progressive degeneration of the joints caused by wear and tear theory. So, just like damit or kotse. Diba? Pag in later years mong ginagamit, so, masisira na to. Just like your bones. Okay, your osteo means bones. Affects the weight-bearing joints and joint that receives the greatest stress, such as the knee, toes, and your lower spine. And then, weight loss ang dapat dito ha, kasi para hindi ma-traumatize yung knee, toes, and your lower spine. The cause is unknown but may be caused by trauma, fractures, infections, and or your obesity. Assessment early. We have joint pain and diminishes after rest and intensifies after activity. And your late pain occurs with slight motions or even rest. Even at rest. Symptoms are aggravated by temperature changes and humidity. Yes, gabi yung osteoarthritis. Pag tingtug nga mo o samot, kung init pud kayo mo ngulngul. And we have your crepitus sound. And joint enlargement, particularly sa area nga na arthritic. Then we have difficulty getting up and after prolonged sitting, skeletal muscle atrophy, magamay ang muscle, inability to perform the activities of daily living, compression of the spine as manifested by radiating pain, stiffness, and muscle spasm in one or both extremities. Management, same with your rheumatoid arthritis. Okay, the last disease, we have your gout. Gout affects more males than females. Description: a systemic disease in which urate crystals deposit in joints and other body tissues. It leads to abnormal amount of uric acids in the body. Assessment: excruciating pain in the involved joints, swelling and inflammation of joints. Tophi or hard, fairly large or irregular shaped deposits in the skin and may break open and discharge a yellow gritty substances. Muhubaglag kalit. Ang term niya is your tophi. Imong kamot ang naigout, tingala ka naiburot dira. So, that is deposits of your uric acid. So, because of this, there will be inflammation. So, may low-grade fever siya. Malay, headache, and the tophi is very much itchy also. Management. Instruct the client to avoid foods such as organ meats, wines, aged cheese, and then encourage high fluid intake. Instruct the client to avoid alcohol, provide bed rest during acute attacks, and elevate the affected extremities pag gout. Protect the affected joint from excessive movement, and provide heat or cold to the affected joint as prescribed. Okay, so we're done with your musculoskeletal system. We're going to proceed with your disorders of the eyes and ears. The purposes of your eyes will receive light rays that focus and transmit images through the nerves to the sight center of the brain. We have important parts of the eyes. We have cornea, pupil, lens, retina, tear glands, lids, and lashes, iris. So your cornea is the one the transparent part of the outer layer that protects the eyes. So mura siya kanang film, ang cornea. While your pupil, it controls the amount of light entering your eyes. And lens, we have bends the light rays to focus on the retina, and then the retina is the one that contains special nerve endings for your sight. Okay. And tear glands produces tears to keep the eye moist. And lids and lashes, it protects the eyes from injury. I have suffered from paralysis before. Water is very much painful. Even we have lids and lashes. I'm not spared with the pain brought about by simple tubig. We have iris, a circular colored muscle that automatically controls the size of the pupil to adjust the amount of light coming into the eye. Disorders of the eyes, we have aging process as a risk factor, katigulangon. Trauma, heredity, kaliwat, congenital, pagkatao na anay daot, and medications. Diba, have you seen some children pagkatao na glasses na because they have defective eyesight? But more or less, it is brought by aging process. Blindness is loss of vision. We have management. When speaking to the clients who has limited sight of blindness, use a normal tone of voice. Dili pwede mo shout. Orient the client to the environment. Allow the client to touch objects in the room and use the clock placement of food in the meal tray to orient the client. When ambulating, allow the client to grasp your arm at the elbow. Yes, para the arms is kept close to your body so that the client can detect the direction of the movement. Instruct the client to remain one step behind you when ambulating. Dapat one step behind yung client. Instruct the client to use canes which is used for the blinds. Alert the client when you are approaching and when you are leaving. Provide assistance only when needed. And next, we have your glaucoma, an opacity of the lens that distorts the image projected onto the retina and which can progress to blindness. The cause of that, not glaucoma, cataracts, is the opacity of the lens. Is your aging process still senile cataract? Inherited kung kaliwat, congenital cataracts, injury, so traumatic cataracts, and result of eye disease, secondary cataracts. Assessment, opaque or cloudy white pupil. Okay, gradual loss of vision, blurred vision, decreased color of perception, dili maka-identify kung unsay color, your blue, green, and sa padira. Particularly blue and green may interchange. Vision that is better in dim light with pupil dilation. So remember, and we have also photophobia. Do you believe that you are able to see during the night, but you are unable to see during the day? Bakit? Kasi with the given light, hindi na mag-e-effort yung mata mo para makakita ka. 'Di ba? So, hindi ka naman, so para bang walang effort si mata, so bulag ka during the day, but makakita ka during the night. Kasi mag-open si mata para makakita ka ng liwanag, 'di ba? So, management is your surgical removal of the lens on one eye at a time. Dapat isa sa isa, tapos schedule yun man yung isa. And then last, we have your glaucoma. Abnormal increase in the intraocular pressure leading to visual disability and your blindness. Cloudy, blurry vision. Artificial lights appear to have rainbows, or sometimes called as halos around them. Loss of vision, pain, headache, and nausea, and vomiting. If you have glaucoma, makasukaon ka. Management, surgery, of course, removal of the affected eye. Of course, glaucoma, it really results to blindness. Medications, avoid tight clothing, especially your collars. Constricted ka, maka-impede siya sa blood circulation. So, masamot siya ka, dili ka kita, kaya wala man nourish ang eye. Reduce external stimuli. Okay. Avoid heavy lifting training during defecation. Bawal siya ma-constipate. Instruct the client to report eye pain, halos around the eyes, and changes in the vision to the physician. Now, we will proceed with the ears. The problems of the elderly when it comes to the ears is, of course, presbycusis or loss of hearing. Purpose of the ears, it receives and sends sound through nerves to the hearing center of the brain. We have important parts: outer eardrum, middle ear, and inner ear. So, outer to the inner ear, it is connected accordingly. So, outer is connected to your eardrum is connected to the middle ear, and your middle ear is in turn connected to the inner ear. So, anyways, your middle ear is the one that has 3 tiny bones that receives the vibration from the eardrum and sends it to the inner ear. While your eardrum, it is between the outer and the middle ear. It receives vibration and sends them to the middle ear. Once to remember, the auditory canal leads directly to the delicate eardrum. Nothing should be placed in the area. No cotton swabs, hairpins, pencils, and fingernails. How would you clean your ear? Use your little finger wrapped with cloth. Damage to the eardrum may cause hearing loss, and the eustachian tubes connects the throat to the middle ear. It makes equal the pressure within the ear and the throat, but it can also transport infection from the throat to the middle ear. Monang kung nakaisipon, of course, you have also problems with your hearing, sakit imong dalunggan, because it is brought about by your pressure. Problem is the hearing problems, which rank high as a health disability. Signs of hearing loss, frequently asking people to repeat statements. Yes. Straining to hear. Ang mata mo, gamay, kay wakadungog. Turning head on or leaning forward to favor one's ear. Shouting in conversation, ringing in the ears. We have also failing to respond when not looking to the direction of the sound, irritability, answering questions incorrectly, raising the volume of the television or radio, and avoid large group, kay maulaw siya, kay nga magstoryahan na, di niya, maupi siya, kay di siya kadungog. Better understanding of speech when in small groups. Yes. Withdrawal from social interactions because of this. So, dapat kung maggrabe na, we should wear hearing aids. So, how would you facilitate communications? We have here use written words and the client is able to see, read, and write. Providing plenty of light in the room, facing the client when speaking, talking in a room without distracting noise. Moving close to the client and speaking slowly and ear clearly. Dapat you were going to utilize the ear nga dili pa siya bungol ha in talking. Getting the attention of the client before you begin to speak, and then talking lower tone of voice. And then we have also, because shouting is not helpful. Okay, so do not shout. Repeating information. Okay. Validating with the client understanding of statement made by asking the client to repeat what was said, and using sign language, yes, and then using telephone amplifiers and installing flashing lights that are activated by ringing of the telephone doorbell, using special trained dogs that help in the client to be aware of sound and to alert the client of the potential danger. So, those are all for your geriatric 2. I am done. So, we're going to discuss mental illness, but this time I have divided it into 3. Your Geria 1, Geria 2, and your Geria 3. So, your mental illness is under your Geria 3. So, I'm going to discuss that one next time. But of course, I'm going to have it separate grade for your Geria 3 para dili kayo taas. Okay, bye for now.